From a clinician's perspective, it's quite worrying because as clinicians, we're used to how to don gloves, which is putting them on and doff them off. There's a certain technique which you have to practice and practice and practice. And it's to make sure that you don't infect yourself or reinfect others. So obviously seeing people in the community wearing gloves, they might think they're protecting themselves, but they could actually be cross-contaminating others because they're not washing their hands, they're not changing their gloves frequently. Even the donning and putting on the gloves and taking them back off again, they could be reinfecting themselves. So from a clinician's view, they shouldn't wear gloves. But obviously, if they want to reassure themselves, then they need to know how to put them on properly and take them off. And there are YouTube videos out there which they can watch to learn this process.
Okay, sure. I suppose one of the things that could happen is you might get a false sense of security, and then rather than try to touch things minimally, you might think, I'm fine because I've got gloves.
Yeah, and the worrying aspect as well is it's human nature. The way you peel them off from the outside, which is contaminated, you're recontaminating your skin underneath. And sometimes you're not conscious of the fact you're touching your face, you're moving objects about, then you're touching other surfaces. So I don't think they're aware of those things.
Okay, so in short, the advice would be, unless you have to, don't wear them. If you're going to try to learn how to take them off, put them on.
Learn how to put them on and off properly without contaminating yourself and others. Wear them for short periods, use them just for what you're going to do, and then take them off in the appropriate way, and then thoroughly wash your hands.
The field hospital has opened at Europa Point, staffed by some excellent nursing leads from the GHA. What can you tell us about the setup there?
And I think our key objective was to set up a facility that was of the same standard as St Bernard's, so nobody would feel that they're getting a lower standard of care. The gold standard for any nurse is, would you be able to deliver that care? Would you be happy with that care for your relatives or your loved ones? And if we can reach that standard and we can say that we're happy with that, then we're good to go.
And it carries Florence Nightingale's name, and that's significant.
This year would have been the 200th birth anniversary of Florence Nightingale, and the World Health Organization had organised like a global celebration for all nurses to come together to celebrate where we are as nurses and where we are as autonomous practitioners going forward. Obviously, we've had to put those celebrations, preparations to one side.
Well, that was one of the things that was very apparent in the field hospital. It was how prominent the nursing staff were and how highly regarded they were by all politicians, decision makers and managers at the GHA.
I think the same as you have the foundations of a house, you can't have a hospital without nurses. That's always been the foundation pillars of any healthcare institution. And I think it's been recognised not only from our government from a while now, but obviously from going forward about the importance of training and the registered nurses and what they offer and what they play, which is the most important, crucial part, I think, because even though doctors and other clinicians are within the hospital, but the one that's always around, the one that's always there with the patient itself, the family, or whatever, is the nurse itself.
You don't only oversee nurses, you also oversee the ambulance staff. Tell us a little bit about how they've prepared for COVID.
Okay, the ambulance staff themselves have done a lot of training and a lot of scenarios in the last couple of weeks. They're quite a small cohort, but a very well-skilled cohort, from our emergency ambulance technicians to our EMTs to our paramedics. As they're a small group, they've had to bring in outside help. We had people that were ex-army or ex-first aiders who we've managed to train in the last couple of weeks to assist our ambulance staff. So they've gone through a period of training from anything from basic first aid, basic life support to blue light training, just to be able to assist us when the time is needed.
And we have seen a bit of a pickup already in their activity related to the virus.
Yeah, they've been called to several residential areas, obviously in Gibraltar. I think it's been captured on social media where they've had the full PPE gear on. The main aim of that is obviously to protect the patients, to protect themselves as key healthcare workers, and to make sure that they convey the patient, however sick or ill they are, to A&E and St Bernard's.